Okay, welcome back. And we ended up on Objective 5. And these are just some nursing diagnoses that you can look up on your own. And it kind of goes A through B here on this slide. And then when you look at the next one, this is C through D. And actually, that's only, just through D, as the slide said in your Ackley and Ladwig Nursing Diagnosis Handbook. So when you're going into clinical, be creative and use some good ideas when you are working with your patients to come up with some great nursing diagnosis. Don't just think of the simple, easy ones. Kind of think outside the box and see what you can come up with. Now we're going to talk about the goals of childbirth education classes. And really, the childbirth education class helps the individuals and their family members try to make informed decisions, safe decisions, good decisions about pregnancy, birth, and then early parenthood. When you think about childbirth educations, educate the early experiences have a tremendous impact on the development of children and the family. It's much easier to deal with women that have had these childbirth education classes and come in to have their babies than it is to deal with moms that don't have any idea about what might be going on when they are coming into labor, maybe when they should show up at the hospital, what they should expect, things like that. So childbirth education really focuses on that early intervention, early treatment, and that's the way that we see healthcare going in the year 2013. So we're going to see continuing advances toward preventative measures. So why is it important for a client to attend these childbirth education classes? Well, it's important to have that education. We want them to know what's going on. We want them to have a healthy pregnancy. They need to consider taking care of themselves. When they take care of themselves, they're going to take care of the fetus. They need a good solid base education so that they have some knowledge coming into the labor and delivery, going through pregnancy, taking care of of themselves as a whole during this time of childbirth years. So it needs to start, in that pre-pregnancy period, when they're taking care of themselves, exercise, diet. So having a good nutrition, stop smoking, alcohol in moderation, vitamins, folic acid, really getting their body prepared. And then as they are pregnant, then taking care of themselves. And then, as they progress through the childbearing years, we'll talk more about menopause and things like that. But it's really important for them to come in with some knowledge about how to take care of themselves, what to expect when they come into the hospital, so they know what a fetal monitor is. They know that we're going to be looking at the baby, knowing what to expect of when their body makes all these changes through pregnancy. It's really important, again, I can't stress enough about HIPAA and the regulations in regards to obstetrical services. Small communities, you might be working in, let's say Spirit Lake, and somebody in Spirit Lake has a baby and they know that you work there, and they come up to you and they say, "Oh, I heard that Casey had a baby in your hospital." And you would say, "Oh yeah, she did, she did really great." Well, unfortunately there you just, set yourself up for fines, set yourself up for jail time, because it's not it's not, with HIPAA, we will be breaking violations if we talk about our patients outside of the hospital setting or outside of the nursing home, whatever type of healthcare setting that you're working in. So remember that if you are caught breaking those HIPAA laws, then you're going to set yourself up for big problems, potentially losing your nursing license. And really, why are you all here? You're all here to get that nursing license. So we need to remember that kind of mum's the word, so to speak, and we really can't talk about our patients. Say, a good way to handle that is, I really can't talk to you about that, but thanks for asking, but I work in the hospital, and so it's really not my responsibility. I can't really talk to you about that. So if you say I can't talk about it, then it kind of just puts a cap on it and lets them know that, hey, that's a line that we can't cross, and we just need to move on with that conversation. So HIPAA, big problems, small communities, even bigger problems. recognizing cultural differences and incorporating support of culture in a nursing care plan. So, what your book talks about is CRASH, and it's very centered around culture. So, culture, show respect, assess or affirm their differences. So, how are we different? How are we the same? Show sensitivity and awareness, sensitive to their needs, aware that they do have specific cultural needs that might be different from yours and mine, and then do it all with humility. So be respectful of these folks coming in of different cultures. When you're working with them, you need to recognize these differences, and lots of cultures have different childbearing beliefs. There's videos that you hopefully will see when you're out in clinical that really show great cultural differences. Some women prefer to come in, when they're 8 or 9 centimeters and almost ready to deliver because they want that time at home and they really want that personal space. So personal space, not meaning personal space just being at home, but personal space in the room. In our Western culture, women are really, they want that personal touch. They want you to be in the room. They want that help from you. Whereas other cultures don't enter that space. Know that there is a space that you don't need to cross, and you will note that, maybe mothers or mothers-in-law step in and help take care of the mother, help take care of that baby. So just be aware of what their preferences are. Time orientation. There are many cultures that aren't as time orientated as those of us of the Western culture. And so be aware that maybe if they have appointments or they say I'm going to be there in a half an hour, it might mean that they're going to be there in 2 hours. So time orientation is very different across the cultural boards. Family roles I kind of talked a little bit about, but just be aware of what the family roles are. Oftentimes you may see that the head of the house, being that the husband, makes decisions for the wife, but just be cognizant of those family roles. And then the use of interpreters. It's always very important to utilize interpreters when speaking to those that are not able to understand the English language. And interpreters, we'd like to use professional interpreters if possible. So if your facilities have that available, utilize that. If not, the phone services that they have for interpretation works out very well. It's not always the greatest to utilize family members, especially if they're younger children. Adult family members, probably, you can kind of hope that things are getting conveyed as best as you can, but really, trying to avoid those younger children is probably going to be most important. Identify cultural and socioeconomic factors that may affect pregnancy. So these are all listed out across your chapters, and when you're looking at factors that can affect pregnancy, race, ethnic background, rural and urban communities, adolescent girls, older women, incarcerated women, refugee migrant women, homeless, low literacy, when you're looking at those, they all come with special needs, and this is in chapter 3 of your text. So I would just spend some time reading about each of these women and what their specific need and how that specific need can affect their pregnancy and how their outcomes may be. And then take a look back at the Healthy People 2020 goals. How do these impact these women? The biggest goal behind 2020 is that we're seeing a decrease in poor outcomes. So we're wanting to see decreased mortality rates, decreased neonatal deaths, those types of things. So how do these women in these types of situations, how will that impact our goals that we're striving for when we reach 2020? Services for home care in the community. What you'll be seeing when you go into the hospital settings and you're working in women's health, home visits are extremely important, especially if you have at-risk populations. We'd like those women to have home involvement and public health nursing. Along with those home visits and public health nursing, you do need to center on your patient, but you also need to center on yourself. So what are some safety issues that you as a nurse might run into? Identifying those safety issues and making sure that you address those so that you are safe, and that your patients are safe in their homes. So, what kind of home environment do we have? When you think back to Florence Nightingale, the environment and cleanliness and decreasing those infection control issues, things like that. So identifying those risk factors and then using ideas to implement better behaviors to have better outcomes. And then obviously infection control, washing your hands is huge, number one. So ensure you're teaching about washing your hands, especially when you go into homes that maybe they have siblings and the siblings are not well kept, and maybe they're touching mom or maybe they're touching babe throughout pregnancy. With pregnancy, how is she caring for herself? Just simple things: wiping front to back, washing your hands before and after the restroom, washing your hands when you're working with food, things like that. So just be aware of what those risk factors are. And then some barriers to receiving health care. Obviously, financial is a huge barrier. Those, do they have insurance? Don't they have insurance? Do they have the money and the ability to buy the gas to get to and from institutions for their care? Cultural, gender, age, substance use and abuse, cigarette smoking, alcohol consumption, and nutrition. All of those are going to have some impact on how and why that person receives care during their childbearing years. And so just be aware of what those barriers are. I think I'm going to end here. We'll discuss Unit 1 just a little bit in class when we meet the first time. If you have questions, please bring them to class and we will discuss them during class time. I thank you for listening to my presentation, and I will see you all very soon.